Hi, I'm Dr. Susanna Park from San Diego Fertility Center. Today we're going to talk about criteria for egg donors and surrogates. So why do gestational carriers need medical screening to start a process? There's so many reasons to make sure that you are healthy. So first and foremost, your safety and your health is our number one priority. Many times, a lot of surrogates have gone through pregnancies and they think, I would love to help another family, which is fantastic. But then when we look at your pregnancy history, I realize, okay, wait a minute, there were some risk factors in your history that may then put you at further risk should you get pregnant again in the future. Conversely, for the intended parents, we want to make sure that you grow your family, but at the same time, keep the surrogate safe. So another reason for medical screening is to make sure that the intended parents don't inadvertently pass an infection on to the surrogate, so we need to make sure that she's healthy. So as a gestational carrier, these are the steps that will happen during your screening. So first and foremost, your surrogacy agency, GS Healthcare, will do a preliminary screening just to make sure that you meet the general criteria to be a surrogate. We have a national organization called the American Society of Reproductive Medicine, ASRM, and they have put forth some general criteria. So one is an age of 21 to 45 years old. Now that is a recommendation. I will say personally, I find 45 to be a bit on the older age to be a surrogate, but just so you know that that is within their recommendations. 5 or less deliveries, regardless if it was vaginal or C-section, 5 or less total deliveries, but 3 or less cesarean sections. Again, there are some out there who feel, wow, 3 C-sections is quite a lot, but this is our national organization, ASRM's recommendation. They also want to make sure that of your pregnancies that you have had at least one uncomplicated delivery. And then a stable family. Why is that important? Because through this process, you will need support, and we need to make sure that you have your support infrastructure in place because there's so many emotions and mental energy that will go into this process separate from the physical medical part. So it's really important to have people there around you who will rally you through the process. The other important criteria, which is less medical, but again, more your surrogacy agency will delve into is why are you being a surrogate? What is your motivation for doing this? And then our fertility center does have a weight criteria, which is measured by your body mass index. So those are the general criteria. Then the fertility center would delve deeper. So the first thing we do is we get the records from your past pregnancies. So ideally, we want to get your office records from your OBGYN, as well as the hospital records. And this is for each pregnancy. Now, sometimes it just happens that perhaps your past pregnancy was 10 years ago and they won't have the records, and that we understand. But if your pregnancy most recently was 2 years ago, there really should be no reason why those records cannot be obtained. And review of records is so important because this is actually where we read through every single line, every page. And if we're going to reject a surrogate, most of those rejections are based on review of these records. So this is such an important step in the process. This process takes about, depending on the number of records, 2 to 4 weeks. And many times, once we read the records, we realize there's a potential medical issue, and often we will ask for more information just to make sure everything is okay. Once you've passed the medical review part, then we have you come to our office in person for medical evaluation. Now, when you come to our office for medical evaluation, it's not that common that we actually end up rejecting you. Well, why would that be? Because we've done so much of our work up front that the rejection rate is quite small once you've come to our office. And that's very important for you as a surrogate because it saves you time, right? You don't want to take the time off from work, time away from your family to come for a medical screening, which takes about 3 hours. But still, if you don't live here, you have to get on an airplane, you have to come here, that's time away from work. And for the intended parents, that's also important that we don't reject the surrogate after she comes here because the intended parents paid for your flight, paid for your hotels if you need to stay at a hotel, paid for the medical examination. Once you come to our office, we do a full physical exam from head to toe. We just want to make sure that you are okay. We also measure your height, your weight, your blood pressure, your pulse to make sure that that's okay. And many times, surrogates are quite nervous when they come to our office. So it's okay if that initial blood pressure is a little on the high side. But as you are in our office for a number of hours and your nerves start to calm down and you realize, okay, I'm doing great and I'm passing all these little milestones in the process, many times your blood pressure will come down. We'll check it again and it'll be normal. The other thing we do, of course, is we focus on your weight, because we want to make sure that you have a healthy weight for the pregnancy. We also do a very in-depth examination of the uterus. So that's a vaginal ultrasound to look at the thickness of the uterus, which is called the endometrium. And then we also put water in the uterus to do a test called a saline sonogram. And that is where water goes into the uterus and it opens up the walls of the uterus to make sure that there's nothing growing in there. There's no polyp, there's no fibroid, there's no scar tissue. And this water test, if normal, usually takes not even 5 minutes. And it's usually very painless, especially if you've had vaginal deliveries. The water test is also important because it gives you an idea of what an actual embryo transfer would feel like, but it's even less painful than that. So a saline sonogram is actually quite easy, and an embryo transfer is even easier. So this whole process takes about 3 hours. When everything is done, one of our nurse practitioners, nurses, or physician's assistants will sit down with you and just go over the process. An ideal calendar. What are the medications? How do you take the medications? And even if you've been a surrogate in the past, we still like to go over this because some centers do things a little differently. So we just want to make sure that you are well informed. And then when that's done, then your physician will sit down with you and just go over the process again, answer any questions you may have. So that whole process takes about 3 hours. So if the surrogates don't live locally, as many of our surrogates don't, usually you will fly in either the night before, stay at a hotel, come to our office, and after about 3 hours, you go on a plane and go back home that next day.